Hello everyone, I'm Rara from UniKL RCMP. I would like to share the result of our study, which is titled Weight Perception, Weight Stigma Concerns and Overeating Tendencies of Malaysian Adults. So, high prevalence of obesity and overweight cases have become a worrying issue in Malaysia. We know that obesity may cause many health problems and metabolic diseases as well. There are some factors that may cause obesity, and one of it is binge eating. This binge eating is actually associated with overeating tendencies in some individuals. That's why we want to highlight overeating tendencies topic in our study. Studies have found that people who have the tendency to overeat are more likely to be overweight or obese. For this matter, it is important to have the correct self-perception of body weight because it is one of the significant aspects in management and prevention of obesity. Overweight self-perception is actually aligned with the attempt and desire to lose weight among overweight adults. But in contrast, some studies have found that unhealthy eating habits were more likely observed in those who wrongly perceived themselves as overweight. Weight stigma is described as discriminatory views and behaviors towards people due to their body weight. Weight stigma in the community is supposed to motivate overweight and obese persons to reduce their weight, but ironically, it may give the opposite impact. Weight stigma may increase the stress level in some individuals and has been assumed to promote eating disorders such as overeating. To investigate the association between weight perception and weight stigma concern with overeating tendency in Malaysian adults, we conducted cross-sectional survey-based study. Our respondents were Malaysian citizens aged 18 to 60 years, and our sampling method was non-randomized using combination of convenient and snowball sampling. We distributed our validated self-administered questionnaire via online using Google Form through some social media platforms. There are 4 parts of our questionnaires, consists of questions that are related to our study parameters. And this is the socio-demographic characteristics of our respondents. Next is the results from evaluation of respondents' self-weight perception. We compare respondents' self-perceived weight with their actual BMI categories, and we found that most of the respondents, 75%, perceive their weight correctly, while 10.8% underestimate and 14.2% overestimate it. In conclusion, 25% of the respondents perceive their weight incorrectly. Next is respondents' weight stigma concerns. These are the questions related to weight stigma, and we found that more than half of the respondents, which is 56.8%, they are concerned about weight stigma, and only 8% of them are not concerned about weight stigma. And last is the result from overeating tendencies questions. These are the questions. We found that most of the respondents have moderate overeating tendencies, which is 45.7% of them, and only 13.3% of them have high overeating tendencies. Based on the questions, we found that more than half of the respondents say that they often eat more when they are stressed and sad. We also investigate the association between respondents' characteristics and study parameters. We found that gender, age, employment status, marital status, and personal incomes are significantly associated with self-perceived weight, while overeating tendencies is significantly associated with ethnicity, employment status, marital status, and personal income. Last, we also investigate the association between study parameters. We found that there is a significant association between accuracy of weight perception with overeating tendencies, and also we found that weight stigma concerns showed significant correlation with overeating tendencies, although the correlation is only weak. And our study also has some limitation. First, self-reported weight and height that were used to calculate participants' BMI may be inaccurate because we didn't measure it directly. Second, is although we already achieved the minimum sample size, it still cannot be used to represent Malaysian population as we didn't do cluster sampling. And the last, sample did not represent the balanced amount of some important variable that might affecting the results such as age, ethnicity, group, employment status, etc. Our conclusion supports the results from some previous studies. That is, correct perceptions of one's own body weight is important in management of obesity because wrong perception may contribute to overeating tendency. Furthermore, weight stigma concern may also contribute to overeating tendencies, which is commonly triggered by stress. So these are our references. With that, I thank you.
Assalamualaikum and salam sejahtera. I'm Adiani Muhammad Rizwan from Universiti Kebangsaan Malaysia. I'll be presenting a research conducted by one of my master student entitled The Outcomes of Reperfusion Therapy with Streptokinase versus Tenecteplase in Patients with ST Elevation Myocardial Infarction. IHD is the number one killer either globally as well as in Malaysia. Statistics from 2016 have showed that more than 9 million mortality worldwide has been attributed to IHD. In Malaysia, ischemic heart disease is the principal cause of death for the past 15 years. In 2019, 15% of Malaysian mortality, with an average of 45 deaths every day, was related to ischemic heart disease. Primary PCI is the preferred option for the management of STEMI. However, in Malaysia, fibrinolysis is currently the primary reperfusion strategy more than 70% of the cases for STEMI management in Malaysian public hospital. This is mainly due to the limited number of PCI capable centers in our country. In Malaysia, streptokinase and tenecteplase are the only two fibrinolytic agents used for STEMI patients. The general objective of our study was to evaluate the outcome of tenecteplase and streptokinase as reperfusion therapy among STEMI patients in Hospital Kuala Lumpur. For specific objective, the first one is to compare the 30-day all-cause mortality post-fibrinolysis, and secondly, to compare the incidence of major bleeding post-fibrinolysis. This was a single-center retrospective study conducted in Hospital Kuala Lumpur. We included all adult STEMI patients who received either streptokinase or tenecteplase in the emergency department. Data were collected from 2016 until December 2020. A total of 698 patients were included in the final analysis, with 349 patients in each streptokinase and tenecteplase arm. After matching was done, as you can see from the table, there was no significant difference between streptokinase and tenecteplase in all variables that potentially may affect the 30-day all-cause mortality. In terms of the primary outcomes, as you can see from the table on the left, it shows the frequency of primary outcomes of all-cause mortality, stroke, as well as bleeding. There was no significant difference between streptokinase and tenecteplase in all primary outcomes. In-hospital mortality rate, however, was 100% in all patients who developed stroke after fibrinolysis. Our study showed that streptokinase and tenecteplase were equivalent in the effect of mortality, strokes, and major bleedings. The findings on mortality and major bleeding were actually on the contrary with the findings from the previous study. What they were saying in the previous study was that streptokinase was found to be higher in terms of the risk of all-cause mortality within 30 to 35 days and had a major bleeding episode as compared to tenecteplase. Our findings actually suggest that the prevalence of mortality and major bleeding following streptokinase and tenecteplase might be different between Asians as well as the Western population. In conclusion, streptokinase and tenecteplase are equally effective and safe fibrinolytic agents in STEMI reperfusion therapy in our multiracial population. There were few mortality risk predictors following fibrinolytic therapy, such as failed fibrinolysis as well as bleeding events. With that, I thank you for listening to my presentation.
Assalamualaikum and a very good morning. My name is Farhana from UniKL and today I will be presenting my research entitled The Effect of Particle Size on the FTIR Spectra and Chemometric Models for Determining the Source of Gelatin. Generally, FTIR analysis measures the range of wavelength in the infrared region that are absorbed by a material. This is accomplished through the application of IR to sample of a material. The sample's absorption of the infrared light's energy at various wavelengths is measured to determine the material's molecular composition and structure. It is reported by Charles et al. That the particle size of sample have an effect on peak intensities of FTIR spectra. In this research, we are using gelatin as the samples since gelatin are having different bloom strength. The higher the bloom strength, the stiffer the gelatin. For your information, gelatin is one of the most versatile and utilized gelling agent used in various industries, including the pharmaceutical and food industry that can be derived from animals, including bovine, porcine, and fish. It is believed that the size of gelatin samples have an effect on FTIR spectra, hence will influence the source determination model. So the objective of this study is to ascertain the chemical structure based on the FTIR spectra, and the second one is to identify the effect of particle size in classification model using FTIR spectroscopy and chemometrics. What I did is I divided gelatin into two groups. With the first group, sample was grinded and sieved using laboratory blender and sieve with size of 800 micrometer. And in Samantha et al., it is reported that excessive sample grinding will affect the material atomic order as revealed by changes in the mid-range IR. So 800 micrometer is considered as the best size for grinding. While for the second group, I used originally without any pre-treatment. Both samples group was analyzed using ATR FTIR to acquire all the spectra, and the spectra then undergo the chemometric analysis using unscrambler software. As a result, in the spectra shown here, there is a difference in absorbance intensity with standardized particle size. Samples is higher than non-standardized. This result was supported by Myers et al. Research that stated the smaller particle size is occupied the empty space, thus making the light scattering effect is lessening. And all the FTIR fingerprint were preserved on both particle size. And in principal component analysis results, standardized particle size samples reside at the right side and non-standardized at the left side completely separated. PC1 described 58 of the variation, while PC3 accounted for 8% of the variation, which resulted in a model that described 66% of the total variance in the model. And to test the accuracy of the classification model built, PLSR analysis was used. Based on the regression value of the PLS plot in here, it is confirmed that the standardized particle size having a higher value compared to non-standardized particle size with 0.627 and 0.9172 respectively. According to Lahumi 2017, the RMSE is a good measure of how accurately the model predicts the response and is the main criterion for evaluating model performance in the regression analysis. If you can see, the RMSE value of the standardized particle size is having lower value than non-standardized, with the value of 0.0015 and 0.0018 respectively. USE is the square root of the variance of the residual and indicates the absolute fit of the model to the data. It is how close the observed data point are to the model's predicted values. In conclusion, absorbance intensity of standardized particle size spectra is higher compared to non-standardized particle size, and all fingerprint is preserved on both particle size spectra. With the aim to optimize the classification model of gelatin sources, standardized particle size should be implied. This is by looking at the good value of R squared and RMSE value. And this is all my reference. And thank you.
Hello, I am Jordan Dion J. Kundahal from Faculty of Pharmacy, UiTM Cawan Pulau Pinang Campus Pertama. On behalf of our team, I would like to share our study titled Impact of the Comorbidities and Medication Usage on Psychosocial Wellbeing and Quality of Life Among the Elderly with Type 2 Diabetes mellitus Preliminary Findings. In my subsequent presentation, I will use the abbreviation T2DM to represent type 2 diabetes. First, I would like to give a brief background to our project. So we all know that T2DM affects more than 25% of the global population aged more than 65-year-old. T2DM is known to increase the risk of cardiovascular diseases, and therefore complex drug regimen is often needed. The landmark DONE study stated that quite a substantial of patients, where 65.6% of patients had experienced psychological problems, and another study found that T2DM patients aged more than 50-year-old have poor quality of life. Medication adherence is therefore pivotal for good glycemic control among patients with T2DM. Nevertheless, the impact of multiple medication usage in elderly with T2DM is underreported, particularly on their psychosocial well-being and quality of life. Therefore, our study aimed to investigate the types of comorbidities and drug use among elderly with T2DM to determine the relationship between the number of comorbidities with psychosocial well-being and quality of life, and to determine the relationship between the number of medications with psychosocial well-being and quality of life. This is a preliminary analysis of the cross-sectional survey data from the longitudinal aging study in Malaysia, which known as the ageless study. The questionnaire included the socio-demographic characteristic, the drug regimen, and validated questionnaire were used to assess the quality of life, in which the 12-item CAP scale was used, 15-item GDS scale for depression, 4-item PSS scale for stress, and 7-item DAS scale for anxiety. The study has received ethics approval, and the data analysis was performed using IBM SPSS version 26. So what we do is that we extracted 796 data from the ageless database from September to December 2020. We then screened the data using these criteria. Firstly, age must be more than 60 years old, diagnosed with T2DM with or without other diseases, and must be treated with either oral or injectable anti-diabetic agents. So we end up with 188 complete data for analysis. This is the respondent socio-demographic characteristic. We observed the respondents' mean age is 73.94. Most of them were female, Indian, married, and with secondary educational level. These are the total number of comorbidities observed from the study. The top two most common comorbidities observed in the respondents were hypertension and hypercholesterolemia, and the total comorbidities range between 1 to 9 diseases, with a mean disease of 3.8, so we can say that each patient have close to 4 types of diseases. Next, the total number of medications consumed range between 1 to 10 medications, with a mean of 4.92 medications. 49.5% of the respondents actually take more than 5 medications, which commonly defined as polypharmacy, and 50.5% take less than 5 medications. The most common type of medications consumed were metformin, statins, and dihydropyridine calcium channel blockers. In our study, we used the CAP scale for the quality of life, and we observed that there are participants that score a maximum of 12, range up to maximum of 48. We recorded a mean of 40.56. For depression, we used the GDS scale, and the score range will be from 0 to 15. As for the respondents, they score a minimum of 3, range up to maximum of 12 with a mean of 6.7. For stress, we used the PSS scale, and the score range is from 0 to 16. Our participants range between 1 to 13 with a mean of 7.72. And lastly, we used the DAS scale for anxiety, with the score range is from 0 to 21. Our participants range between 0 to 10 with a mean of 0.9. For the number of comorbidities, the results show that there was a weak negative correlation between the number of comorbidities and quality of life, and no significant correlation were observed in other scales. Next, for number of medication, there was a weak positive correlation between the number of medications with anxiety, and no significant correlation were observed in other scales. For discussion, the most common comorbidities were hyperlipidemia and hypertension in our study. Our findings actually mirror to previous Malaysian study that hypertension and hyperlipidemia are the common comorbidities among the elderly, although the percentage are lower in the study. Hence, both of these comorbidities need to be well controlled, given that hypertension is known to increase the risk of retinopathy, and hyperlipidemia, if not well controlled, can disrupt glycemic control as well. 49.5% of our respondents receive more than 5 drugs, and the most common 3 prescribed drugs are metformin, statins, and dihydropyridine calcium channel blockers. The incidence of polypharmacy in our study is higher than those observed in Thailand and Germany, but lesser in Korea. We observed higher number of comorbid disorder is linked with lower quality of life among the respondents. This could probably link to the increased problems and distress level that could have limited their productivity and opportunity to enjoy life. We also observed higher number of medications used in the respondent is found to have higher anxiety level in our study. This could probably due to the fear of insulin injections and also the worriedness of adverse drug reactions and drug-drug interactions. For conclusion, elderly with T2DM in this study is often comorbid with hypertension and hyperlipidemia. High number of comorbidities have an impact on their quality of life, and taking a larger number of medication causes higher anxiety level. Therefore, medication optimization is essential in elderly with T2DM. I would like to end my presentation with slides of acknowledgement and references. Thank
A very good morning. I am Lavina. Will be presenting on the screening of chemical compounds from Areca catechu nut extract for its toxicity test on guppy fish post-late reticulata and its potential for Aedes larvicidal. It is important to handle dengue cases. As you see here, there is an estimation of 100 to 400 million dengue cases each year. Malaysia itself shows 119,000 includes deaths. But in 2021, there is a decreased cases in dengue when the government imposed a lockdown for a long period of time. If there is no lockdown, the dengue cases will be increasing. So what I'm saying here is, if there is a decrease in COVID cases, there might be increase in the dengue cases due to these two vectors, Aedes aegypti and Aedes albopictus. These vectors carries the dengue virus, and there is no current control for the virus, which is similar to the COVID-19. So if we look at the method used by the government to control the dengue cases are mostly fogging and also inspection at the suspected area. Fogging is a chemical insecticide which cause many problems like pollution and also creating resistance towards the vector due to a long exposure. In Malaysia itself, Aedes aegypti has developed resistance towards Pyrethroids and DDT. Because of that, we have came to a conclusion that bioinsecticides could be an alternative form to control vector issues. Why bioinsecticides? Because they're environmental friendly and it is isolated from natural habitats. The multiple component of these bioinsecticides will control the dengue cases. That's why we choose Areca catechu, which is known as Pinang. It is easily found in Malaysia. Furthermore, this Areca catechu nut will be tested on the Porcellate reticulata, which is the guppy fish. Why do we test on guppy fish? Guppy fish is it's a very sensitive fish to the environment. If the guppies are able to survive with this nut extract, which means it is not harmful to the environment. Objective: to identify the chemical compounds of Areca catechu nut for its potential for the Aedes species on the larvicidal activity. To compare the chemical compounds of Areca catechu nut extract with other published articles for the potential on Aedes larvicidal activity, and to elucidate the toxicity concentration for Areca catechu nut extract against guppy fish post-late reticulata. Methodology: in this process, I use a dried powder of Areca catechu nut to obtain a better outcome, and methanol solvent will be used because in previous study, methanol shows a better outcome too. The rotary evaporator is to use to concentrate the extraction. Then we solidified the extract into a crystal form. In order to use the analysis for analysis purpose, we dissolve it back into the methanol and process it in the gas chromatography mass spectrometry. By using the NSST library, the mass spectrum will be compared. This crystallized extract will be dissolved into the aquarium to test towards the guppy fish. There are 6 bioactive compounds found from the GCMS analysis, which includes carbonic anhydride, which is used as insecticide properties towards cockroaches, following 2 amino nanodecene as antibacterial, antifungal effect towards insects. Then 2 aziryl ethane amide as antibacterial towards mosquito larvae, moving to the ethane fluoro used as insecticides towards insects. Then 2-pentanamine used as pesticides towards Anopheles mosquito. Finally, phenol 4,2-methane amino-18 used as pesticides towards the rodents and also insects. Post-late reticular star shows a high survival rate towards Areca catechu nut extract. At the lowest concentration, the behavior of the species has no changes, but as the concentration increases, the behavior shows some balancing issue and different in their swimming pattern. As you can see here, the highest concentration, the fish were able to survive and swim normally. This shows that the Areca catechu nut is not toxic to the environment. In conclusion, the chemical compound of the Areca catechu nut from the GCMS analysis shows few chemical compound of bioinsecticides which is able to act as insecticides, antifungal, antimicrobial, antibacterial pesticides. This cubbyfish post-late reticulata shows there is no toxicity in this study. The further studies on Areca catechu nut with LCMS HPLC analysis using the various extraction method will be conducted in order to identify more bioactive component from the Areca catechu nut. That's all from me. Thank you.
Assalamualaikum and hello everyone. First of all, I would like to thank the organizer for giving me the opportunity to present today. My name is Amiza Shaira binti Zaini and I'm currently pursuing my master in Applied Bioscience at UniKL RCMP. Today, I would like to present my research study on the in vitro modeling for studying Schwann cell myelination. The peripheral nervous system, or the PNS, contains nerve fiber, which is a long process of the neuron cell called the axon that transmit nerve impulse. The cell body of the sensory neuron located within the dorsal root ganglia, or the DRG. There are two types of nerve fiber, which are myelinated nerve fiber and unmyelinated nerve fiber. Schwann cells are the main glial cells in the PNS that produce myelin sheath. The myelin sheath insulate the axon to speed up the transmission of nerve impulse. The importance of developing myelination model is to study the neurodegeneration, nerve regeneration, and to study the disease or nerve injury. Some of the myelination models that have been developed from previous study consisting in vivo model and in vitro model. Mostly transgenic animals are used in the in vivo model, while in vitro, monoculture, co-culture are used. However, in vivo models are complex and use large number of animals that lead to strong ethical opposition. Therefore, in vitro models are preferred because it is much simpler that use low number of animals and also align the animal ethics principle, the 3R, replacement, reduction and refinement. So the aim of the study is to develop an in vitro model using neuronal Schwann cell co-culture. The objective of the study are to establish neuronal Schwann cell co-culture model using dorsal root ganglia and Schwann cell line, and to study the effect of adenylyl cyclase agonist in Schwann cell myelination in neuronal Schwann cell co-culture model. So basically, the methodology of the study is to culturing the Schwann cell line on 24 well culture plate for 7 days. After 7 days, neuron cells were isolated from dorsal root ganglia of Vista rat and seated on top of Schwann cell line to develop co-culture. And straight away induce myelination using media containing adenylyl cyclase agonist, which are low dose of phoscolin and 20 micromole of CPT-CAMP. The results were analyzed using immunofluorescence. So for the result, the phase contrast micrograph show co-culture after 7 days of myelination induction using adenylyl cyclase agonist. The morphology of neuron cells were identified as large round cells with neurite projection as shown at the green arrowhead, while the neighboring cells are Schwann cells that were characterized as bi- or tripolar elongated spindle-shaped structure. This shows that neuron cells and Schwann cells were present to establish the co-culture model. The phase contrast results were supported with immunofluorescence analysis on day 7 of myelination induction. The immunofluorescence result shows positive expression of Schwann cells biomarker S100 and neuron cells biomarker beta-3 tubulin. This demonstrates that the neuronal Schwann cells co-culture were established during the experiment. Then, we repeated the same experiment to see the myelination effect of adenylyl cyclase agonist towards the co-culture. The result shows that on day 15, after induced the expression of myelin biomarker, MBP were negative on control group and myelination group. Although we expand the myelin induction to 24 days, the MBP expression was still negative. This shows that the co-culture does not produce myelin sheath in both groups. However, when we stain with promyelin marker CROX20 on day 24, the expression was positive on both groups. This concludes that both groups promote promyelin Schwann cell phenotype in the co-culture. The study demonstrated presence of neuron cells growth in the neuronal Schwann cell co-culture model. However, the adenylyl cyclase agonist did not induce myelin formation in the co-culture indicated by the MBP expression. Interestingly, Schwann cells assume a promyelin phenotype after long-term co-culture in both groups. Even without adenylyl cyclase treatment, still the Schwann cell can express promyelin phenotype. So I would like to acknowledge the Ministry of Education for giving me the FRGS grant, and to my supervisor, Dr. Muhammad Fazil bin Daud, for guiding me, and also to postgraduate members for helping me on this research. So this is a reference. So that's all from me. Thank you.
Assalamualaikum and good day to everyone. My name is Farhana Fakira binti Ismail and my supervisors are Dr. Adiani and Dr. Chong Rowan. We are from Faculty of Pharmacy, Universiti Kebangsaan Malaysia, UKM. So the title of the project is Effectiveness of Patient-Centered Education in Dyslipidemia Management, which has a systematic review. So basically this is the outline of the presentation, which we will go through one by one. So a bit on the introduction, dyslipidemia is one of the modifiable risk factors of CVD, and according to this NHMS 2019, it is stated that 1 in 4 people in Malaysia do not aware that they have high cholesterol. And according to these authors in 2014, Grady and Goff mentioned that in managing chronic disease, self-management is very important. So in order to make sure that the patients are able to self-manage their own disease, the patients must be educated and empowered. So in order to educate the patients, the patient education tool is very crucial to allow this self-management to be possible while guided at the same time, being guided by the healthcare professional. So the objective of this review is basically to compare the effectiveness of the patient-centered education type with the non-patient-centered. So the type of the education, the interventions used in the study were really analyzed thoroughly, and we are measuring these outcomes as stated in the slide. And we are also looking into the theories and possible contributing factors which may lead to the success of the intervention. And this is the methodology of the systematic review, which this study followed the common systematic review method with the databases searches, the screening, and also the study quality assessment. And this time around, we are using the CESP analysis. And for the result, finally, we got 20 final randomized control trial papers to be included in the study. And in this study, we found that it is the patient-centered education is found to be effective and has significant improvement in any of the parameters stated, either in cholesterol level, psychosocial or cognitive, the behavioral in terms of medication adherence, physical activity, and also cardiometabolic parameters. And we also, from the reviews from the papers included, we found that there are many contributing factors that may lead to the success or failure of the intervention. So one of it is the underlying theory used, in which most of the papers were using motivational interviewing, and also they also apply the instant reward system. This is very beneficial to help people to quit smoking, and also dietary education, in which the nutritionists, the nurses educating the patients about eating healthy diet, and also the importance of reaching good HDL level. And then one of the consistent factor that had been outlined in most of the studies is the importance of systematic follow-ups, either via phone calls or face-to-face counseling. And this parameter is very significant in determining the success of the patient-centered education. And then the medication adherence, meaning there are different methods of assessing the medication adherence, and which also may lead to different results. And social support, which is consistent in many of the studies. They mention that patients with chronic disease such as dyslipidemia and CVD, they require social support from their friends, from their relatives, from their wives to make sure that they can handle the disease. And also the collaborative care, which is the involvement of the experts, and they manage to contribute and give input better to the patients according to their expertise. And last but not least, the usage of e-health, which we found that perhaps in the near future we can incorporate, or you can use online counseling in patients with dyslipidemia. So in a nutshell, we found that the patient-centered education lead to many positive outcomes. It shows many significant improvement, and at the same time there are many contributing factors, as I mentioned, which may lead to the success of the intervention. Hence, therefore, future studies may incorporate those elements that may help in the patient educational module to help in the dyslipidemia management. So with that, I thank you.
Bismillahirrahmanirrahim. Assalamualaikum and good afternoon, everyone. Today I'm going to walk you through my research entitled Knowledge, Attitude and Perception on Halal Pharmaceutical among Pharmacy Students in Malaysian Universities. The world is dynamic with different cultures, belief and a religious obligation. The pharmaceutical industries and healthcare system have advanced rapidly throughout the years to cater different needs of patients. Muslim patients have made significant impact in healthcare industry in demanding better medication to suit their belief. On the screen at this moment is the Global Islamic Report 2019-2020 showing increased revenues in halal pharmaceutical sectors. The emergence of halal pharmaceuticals give Muslims informed choice to choose the most appropriate medication accordingly. It is a Muslim's right to have halal medication, to be informed of medication, to choose medication, and finally the rights to give consent for the usage of non-halal medication. In Malaysia, several guidelines were published to facilitate the manufacturing and usage of halal pharmaceuticals in practice. For example, we have MS 2424-2019 Halal Pharmaceutical Standards General Guidelines. This document is rapidly gaining universal acceptance. In pharmacy practice, guidelines in the use of medication from Islam perspective, we have guidelines in the use of medication contains non-halal sources. Both documents were established to address the needs and concerns of Muslims. Besides Malaysia, countries such as England and New Zealand healthcare sectors too have come up with specific guidelines when attending to Muslim patients. As more halal pharmaceuticals products are being produced, healthcare practitioners must equip themselves with the knowledge that will assist their Muslim patients. As one of the first-line healthcare providers, there is a need for pharmacists to be well informed on what halal pharmaceutical is, when to dispense halal medication, and how to handle their need and usage. As pharmacists are responsible to consult and educate the patients about medication, they need to provide the right information to ensure that patients totally understand it. Having some knowledge about halal or non-halal ingredients and practice is an advantage to a pharmacist, as they will be more ready to serve the community and provide better consultation and services. This research is important due to several factors. Based on our review, education on halal pharmaceuticals, especially for pharmacy students, mainly obtained from conferences, workshops, congress, or any other knowledge avenue. On top of that, limited informations are available regarding the level of knowledge of pharmacy students toward halal pharmaceuticals. Besides, the data obtained can be used to improve the current curriculum to prepare our students to become competent pharmacists. As we all agree, pharmacists play a key role in dispensing and usage of drugs. Thus, it is the duty of pharmacists to advise patients regarding the halal status of a drug. With that, the objectives of this research is first to investigate the level of knowledge, attitude and perception towards halal pharmaceuticals. Number 2, to identify the presence of halal-related content in the pharmacy curriculum. And number 3, to identify the factors that influence the attitude and the perception. A cross-sectional self-administered survey were conducted using stratified random sampling method among 257 participants in private universities and 230 participants from public universities. All participants were at the fourth year or final year in their respective pharmacy school. This research was approved by UKM Research Ethics Committee, and a pilot study was conducted among the selected student and field expert prior to survey. The survey were adapted from previous work done by Sadika et al. The questionnaire were divided into 4 sections: demographic data, knowledge on halal, attitude towards halal pharmaceuticals, and perception towards halal pharmaceuticals. The scoring methods used were including yes-no answer and 5-point Likert scale. From the survey conducted among the students in private university, we found out that the respondents are aware of the general concepts of halal pharmaceuticals with good attitude and perception on it. Correlation analysis indicated that knowledge affects both the attitude and perception of the students toward halal pharmaceuticals. Similarly to survey conducted among the public university students, participants show good average knowledge and high correlation between knowledge with their attitude and perception. Zooming into knowledge assessment, when participants were asked questions related to definitions, more than 75% of the respondents were able to answer correctly. However, as the questions were based on application, usage, and management of halal pharmaceuticals, the percentage reduced to less than 50%. The survey conducted among respondents in public universities was showing similar trends with slightly higher value for both observations. Another important highlight of this work was whether the halal education was available in the curriculum. Less than 30% of respondents from both cohorts agreed that they were taught on topics related to halal pharmaceuticals in their course. These topics were embedded in pre-existing main or elective courses like pharmaceutics, quality assurance, and pharmaceutical technology. In conclusion, the respondents have good general knowledge, attitude, and perception towards halal pharmaceuticals. However, students were identified to lack in-depth knowledge regarding the management and issues related to halal pharmaceuticals. Education on halal pharmaceutical need to be included in pharmacy curriculum in order to ensure proper management of halal pharmaceutical and the service. Significant correlations were found between knowledge and attitude, knowledge and perception, and attitude and perception. We've come to the end of my presentation today. Thank you so much for your attention.